Hi, my name is John Austin. I'm a general surgery resident at UC San Diego. Yeah, it's a great question. Our study demonstrates that more children are riding e-bikes, and as a result, more children are also getting injured riding e-bikes. So now e-bikes, when compared to bicycles, are much faster, they're much heavier, and as a result, there's the capability to involve in both single and multi-vehicle accidents, and the results of these accidents can be more severe than your regular traditional pedal bicycles. Therefore, when pediatricians are counseling families about the pros and cons of e-bikes, it's important to emphasize, well, that these e-bikes, while useful for transportation and fun in their own right, must be tailored to the individual child, factoring things in such as age, helmet use, experience riding bicycles, traffic law knowledge, and riding on public thoroughfares. And if they don't, the consequences can be serious and in some cases deadly. Now, it is important to recognize that while these risks also exist with regular bicycles, it's the speed at which these e-bikes can go that significantly reduces the margin of error for riding these in public. Yeah, it's really unfortunate some of the injuries we're seeing. In addition to orthopedic injuries, right, your sprains and fractures, two types of injuries that we do see quite a bit related to e-bikes that are devastating potentially are your multi-system organ traumas, where you get hit or land at a very high speed and essentially have multiple critical internal injuries, or severe head trauma, right? If you crash and hit the asphalt at 20 plus miles an hour and you're not wearing a helmet, the outcomes are devastating and sometimes fatal. Now, to cancel families, pediatricians have to rely on their own judgment on how they're going to approach this question, right? I don't think it's necessarily productive to scare or threaten every family who wants an e-bike with the possibility of horrible injury or death. It's just not a feasible way to conduct a patient-provider relationship. But that being said, it is important to convey the severity of not having basic safety equipment, not following traffic laws, or just being unready to ride a bike that fast. And so pediatricians should be aware of these injuries and be prepared to talk about these injuries, if for nothing else, just to have a context on which to approach an individual conversation. Yeah, I think it's important in these conversations to begin by assessing why a family is buying their child an e-bike and also the family's own understanding of what that particular e-bike's capabilities are, right? Is this meant purely for entertainment, you're riding on protected bike paths or in a public park, or is this meant as transportation to get from point A to point B and they'll be on public thoroughfares? Knowing what the purpose of an e-bike is can help you tailor exactly what that child needs in terms of an e-bike, if they even need an e-bike at all. And then after that, then you can assess that particular child's safe riding practices, right? It's a very different conversation if you're talking to, say, an experienced 16-year-old who's used to riding their bike to home, to school, to other activities day in, day out, versus someone who's buying their 12-year-old an item that they believe will be fun for them. So, beginning from that framework will help pediatricians identify the needs of the individual patient and family and have conversations ranging from, hey, I'm just here to ensure safe riding practices, all the way to sometimes even dissuading families altogether from using this tech until the child is more mature. Yeah, it's a great question. And I think there are many possible avenues for intervention, whether it's medicine, the community, or even in politics. On the medicine side, it relies on providers performing safety checks as part of a good social history during a well-child visit, right? If they find out they have a bike, does the child have a helmet? Do they have reflective gear, appropriate lighting? Where is the child riding? Things such as that. On the community side, ensuring that there are safe areas for children and really bikers of all ages to ride, whether that's in the form of protected bike lanes with bollards, or whether there's a spot where you can go ride your bike for fun. And on the political side, I believe there does need to be some system to ensure that people either have experience riding or can gain experience riding, either in a tested or licensed fashion. And also to enforce the existing rules of the road, not to be punitive per se, but mainly to ensure that people are riding safely and not endangering themselves or the lives of others. Yeah, pediatricians have a critical role in ensuring the safety and well-being of their patients. They, in their specialty, have the unique privilege of following patients as they develop both physically and emotionally, And in that role, they will have the particular ability to be both a safe space and also a clear advocate for safe riding practices, helmet use, protective gear, appropriate transportation, and situate themselves as kind of the biggest personal advocates outside of the home for their patients' well-being. And, personally, as a physician on the general surgery and trauma surgery side of things, I am, of course, a huge fan of helmet laws and pretty much will espouse helmet use whenever I can. I am also a strong proponent of clear classification of e-bikes so parents know what they're buying for their children, and also consistent enforcement of already existing e-bike age and riding regulations in some places. But I think critically overall, what we can agree on is that I want the community to continue raising this question of how we safely ride e-bikes and collect data on e-bike usage and accidents because it's through data-driven evidence and we can produce the most effective interventions. E-bikes are clearly part of our lives going forward, and they're tools that can provide both transportation and recreation. I think our job as physicians is to ensure that as e-bikes do roll out, it's done in a safe and effective way.